Hello there. Welcome.
Thank you for having us today.
You're
My name is Julie Halifax. I'm here as a mother of a 9-year-old child who is severely deaf and hard of hearing. His hearing loss is 55 to 60% hearing loss, and he relies heavily on reading lips. This past year plus has been very, very difficult for him as a student, understanding teachers and other children at school, even with face masks. It's impossible for him to hear clearly with what little hearing he has. Socially, it's affected him with peers, going to public places, field trips. We have to interpret for him. Being at theme parks, he's not able to listen to anything that's being taught. For example, if they're speaking about animals or safety, he's not able to understand that with the 6-foot plus having masks on both ends. So I urge you as a parent for my child and thousands of other children and elderly in Pinellas County to please consider removing the ordinance as soon as possible.
Thank you, Julie. Yeah, and I have your comments on the back of the card as well, so it'll be part of the record.
All right. Hi, everybody. My name's Callie Alonso. I've been here before. I just wanted to make a few comments. I live here in Clearwater, and I've been fairly vocal just about this mask mandate issue. You know, I haven't worn a mask this entire time because I can't wear one. And as I've communicated before, everyone I pretty much know doesn't wear them either. No one's really been sick. We've all been fine. We go out about our business. The thing is, there's a lot of tension, as you probably know. And I watched the meeting, what was it, I think it was last week, and I know, Ms. Long, you had mentioned some comments that you're trying to have leadership here. And by putting these mandates and doing all these things and trying to do stuff that's in our best health. But the thing is, this is not in what we want. You know, you also had mentioned that this is kind of like seatbelts laws, that we just don't need any laws then if we can do whatever we want. But this is different. Putting something over one's face where you cannot breathe, and there are people who do have issues with it, that's not helping people. And people who want to do it, go for it. I'm not saying not to have it happen. But there's plenty of data saying the other side of things. We also have this doctor here who had his side of it, but why are we not hearing from the other side? Because you've mentioned, let's follow the science. There's plenty of science, and there's plenty of science who are saying what we're doing is not okay. There was a whole roundtable that was done with Governor DeSantis. I don't know if any of you guys watched that. There was Dr. Jay Bachara, Dr. Scott Atlas, Dr. Martin Kuldruff, Dr. Suneta Gupta. These are all world-renowned doctors. They say the complete opposite of what we're hearing today. So why are we not hearing both sides? I think it should be fair that we have, one side of the coin, but we should hear the other side too. Just like you're allowing us to give our thoughts. I know that, I'm not a medical doctor, so maybe you don't want to hear my opinion, but there are medical doctors who are saying that we don't need to do this. I mean, if it was really such an issue that it's so deadly and all this stuff, then why have no one that I know been sick? Not saying no one hasn't been sick. I have heard of, it's kind of like this type of thing. I've heard of people. But in my immediate circle, my family who are all over the country, it hasn't been happening. So we're calling this pandemic as if everyone's going to be dropping like flies if we don't wear a mask. But yet, I've been everywhere and we've been fine. So just please take that into account. The people in this county, we want to be able to work together and we want to be able to support businesses and things, but being attacked and having these upsets that are going on, that division that's being created is being created. We didn't have this before this whole thing started, and now people are fighting each other, and it's not okay. So just want you to really take that into consideration, and I appreciate your time. Thank you.
Thank you, Callie. Next, welcome.
Hi, my name is Stacy Geyer, and I live in Largo, Florida, and I'm here to ask that you please end these mandates today. I had a whole list of notes with me, and I'm going to pull them out, but I'm not sure if I'm even going to follow them. Because I listened to the work session last night and was really frustrated. Commissioner Peters, I thank you so much for looking at all of the data and not just one set of data and looking at it comprehensively. The CDC has put out conflicting information regarding the efficacy of masks. They suggest wearing masks, but then They have also stated on their website that this virus is so tiny that the particles actually can go through the mask. So the masks are not really helping. I have family members that have extreme anxiety. I'm even anxious being here speaking today, and I know how bad that wearing the masks has affected them. They're afraid to go anywhere. Also, the British Medical Journal listed harmful effects of mask wearing. It can give a false sense of security. Improper use of face masks, such as touching them, taking them up and down, pulling them off your counter, out of your pocket. These are not sterile masks that people are putting on their faces. And it actually can increase the risk of infections, other infections, and also because you're breathing in that mask, you're creating a humid environment inside that mask. So you've touched that mask, and now you've created a humid area for the virus to grow and inhale further deeper into your lungs. Also, wearing a mask makes the exhaled air go into your eyes, so it causes people to constantly be touching their faces due to the uncomfortable feeling. And as you're touching your face, touching your eyes, adjusting your mask, you're creating more chances to infect yourself. Also, there is a group of doctors and businesses in Tulsa, Oklahoma, that are suing their mayor and their health department regarding the mandate. Dr. James Meehan stated that well-known risks have been well studied and they're not being discussed in the risk analysis. I'm seeing patients that have facial rashes, fungal infections, bacterial infections, and reports coming from colleagues all over the world are suggesting that bacterial pneumonias are on the rise. Why might that be? Because untrained members of the public are wearing medical masks repeatedly in a non-sterile fashion. They're becoming contaminated. They're pulling them off their car seat. Thank you so much for your time. I ask that you please end this mandate. Thank you.
Thank you, Stacy.
My name is A.W. Simpson. I'm a resident of unincorporated Largo. I just would like to make a few comments very quickly, possibly some rhetorical questions. Not sure how many people are willing to come in here, stand up at this microphone, and say they support wearing masks. When I just came from a room full of people, everybody in there is saying it's time to lift this mandate. It's time to stop damaging businesses, stop damaging people psychologically and possibly medically. I have experience in personal protection equipment, federally certified train-the-trainer for HAZWOPER. I train people when wearing a mask could save your life. If you contact any mask manufacturer, they're going to tell you their masks won't stop a virus. They're not meant for that. There are masks out there that will, but they are much more advanced than what people are wearing, especially when it comes to these homemade things. So I think it's time for us to stop lying to ourselves. I would like to thank everybody for listening to me, and please, let's try to lift this mandate and get our county back open again.
Thank you, A.W.
My name's Virginia Frizzle, 14956, Largo 33774. Please give me a minute to put my glasses on. I forgot. Thank you. Sorry. Apologies. Oh, thank you for your time. Today, I just came here to remind the commission, attorney, and administrator Barry Burton, excuse me, he's pronouncing your name right, who seems to be practicing medicine without a license, prescribing masks to be worn even outside, and threatening closure of businesses. About the June 23rd, 2020 meeting before the temporary ordinance of face coverings was voted in and exactly what was said. I'm going to play this right now so that there's no misunderstanding of how this temporary ordinance can be ended easier than when you now choose to make complicated. I'm just going to remind what was done.
Yeah, just a couple questions before, just maybe a comment or two, but
do we agree that we would have a sunset date on this, that we would kind of periodically review this? Will this be reviewed weekly with our executive board? I just was curious about that.
So the county attorney can certainly speak to it, but why don't you go ahead and speak to it, Joel?
The way this is currently written is that it will stay in effect for so long as there is a local state of emergency, unless you all take some sort of action to rescind it prior to that time.
So weekly, when we take a look at this and we take a look at numbers and see trending differently, we could keep the order going and just pull that out, perhaps. I mean, that piece.
Well, keep in mind, this is an ordinance. So you taking action each week on the local state of emergency is really independent of this. So,
but at that time, you could take an action to rescind that ordinance.
You would have to go through the emergency measure to, again, waive notice and do some of the things that you're doing here tonight. But the effective date and duration of the ordinance relies on the local state. But keep in mind, they're two separate actions.
Okay.
Thank you very much. I ask that you call a motion, emergency waiver the rules out as you did in, and put the face coverings to the people as choice. May I also remind the Commission that personal responsibility, individual decision-making, and the freedom to do whatever we want that is not against law is my civil right in the United States of America. Janet, Janet, Janet. And I find it almost laughable that the Commissioner Long does not think so. Thank you for your time.
Thank you. Go ahead, Tammy. Sorry about that.
My name's Tammy. I do not live in Pinellas. However, I live in Pasco and have been fighting the mask mandate there ongoing for months. And as you know, we finally got that dropped. But I do work in Pinellas, and for the first time ever, I just started this job, and I am forced to wear a mask when I'm working with people who can't even understand what I'm saying because I'm with this face muzzle on my face. You can't hear other people when they're talking with a mask. I know that the group in Pinellas has been ongoing fighting this ridiculous mask mandate. I mean, the science is there, and like others have previously stated, you're not listening to that science. We're not getting equal, share here. And I just really would encourage you to drop the mask mandate, because I also work outside. So I don't want to be outside in the summer with this thing on my face. People can't hear me. I'm sweating and all this other stuff. So I encourage you to please drop the mask mandate. Enough is enough. There's been studies. The CDC just came out, 3-4 weeks ago, doing their own mask study, stating that it only reduced the risk or the spread by 1.8%, which is nothing. I mean, I've traveled all over unmasked. I'm not sick. I don't know anybody else that's been sick. I mean, the reason that people get so frustrated coming up here, I realized since this is my first Pinellas meeting, that you guys honestly should have public comment first, because inside listening to that room, listening to the health department guy over here, I was Mr. Show or whatever his name was, it's just ridiculous. It honestly is. So that's why people get so mad, because you're not listening to what the people want. Nobody wants to wear a face mask. And if they do, fine, let them. But I don't want to. I'm tired of it. I had to take my daughter out of school because of it. I mean, enough is enough, honestly. Thank you.
Thank you, Commissioners. Greg Pound. The room over there is just packed with people against this mask mandate that we have. I wanted to read something out of Psalms chapter 103, verse 2. It says, Blessed be Yahweh. Bless Yahweh, O my soul, and forget not his benefits, who forgiveth all thy iniquities and who healeth all thy diseases. Instead of, like Pastor Mac Johnson says, that, our nation needs to repent. And we can just see this thing is really out of control. I mean, we see we see what our governor did. He brought in some of the top people in the world to show us that this thing is, I mean, we don't need to be wearing these masks. And he's lifted the mandate off the state. Now we have to deal with the counties. And you guys are going to keep this on us as long as you possibly can. And I try to, like they say, follow the money. I try to find out what, what's tied to this. But once again, there's on ban.video, where they ban videos that are being put out, Google will not allow them to be shown because they're exposing the corruption with this vaccination, with the mask, this whole thing. It's called Medical Doctor Exposes Mass Eugenics Extermination called COVID-19 Vaccination. And you can find it on ban.video. And so what happens, I don't know if you think everyone in Pinellas County is mentally retarded and you guys have to control their lives. And I mean, everyone I've known has done hours of research to find out what's going on. We don't need, we study, we want to protect ourselves, our families, our neighbors, and our country. And so as, the only people that I know that are dying from this whole thing are those who are getting vaccinated. And I think it's a real sad situation. We've appealed to you. Our governor is set to lead, and there's other states that are just showing us this is a farce. Someone was showing me, if you've got a Lysol can that's 2 years old, you look on the back of it, it says kills COVID. I mean, it says right on the can of the Lysol cans. So, I mean, this is nothing new, but this has been something supered up in order to, like Bill Gates is involved in it, and they said through the vaccinations we can reduce the, 1/3 of the world's population. And so everyone has to get vaccinated, and or we're going to be choked to death out of this situation. So you've got a room over there just filled with people who citizens of Pinellas County, take their time off, take off work, take their day off to come out here and to tell you what's going on.
Thank you. I'm a little ill-prepared and not used to speaking in front of people, but I know that there was a lot of talk about whether this is emotional, and you're darn right it is. It's not only emotional, but I think it's wrong. And I think what we're doing, we're not looking at both sides. There are doctors who have said yes to this and no to that, and we're only hearing one narrative. And I think that's wrong. The mask mandate, I believe, is unconstitutional, and I don't think that anybody has a right to tell us what to do, when to do it, how to do it, because of fear propaganda. I think what is happening in this country is meant to divide us. It's meant to aggravate each side, so we have confliction. When I go into a grocery store and I want to shop, I shouldn't be ostracized by somebody who believes something different. I think that's wrong. I don't criticize other people for wearing their mask. If you want to wear it, knock yourself out, wear it. But don't tell me that I have to wear it. I don't have to wear it because I have anxiety. I have anxiety standing up here right now talking about this, and I can't believe we're even at this point in our lives that we have to do this. They're dividing us, and they're making us enemies against one another. And it's not just here, it's globally, and it's happening everywhere. Don't you see what is happening? They are trying to separate us, they are trying to divide us, and they're trying to conquer us at the same time, getting us aggravated and mad at one another. You think this is about a virus? It's not about a virus, it's about control. And I'm tired of being controlled. I am a free American, and I plan to stay that way. Thank you.
Hello, my name is Christy Alvarez. I live in Seminole, and I'm here on behalf of Pinellas Watch and other community groups that have formed in this past year. I did not come here today to talk to you about the mask mandate, so that's the good news for all of you. I came here to tell you that we see what you did. While we were protecting our families this past year, you closed non-essential businesses, but continued to pay yourselves. All people are essential, except maybe the board of this commission. Never again. While we were protecting our families, you closed our beaches and parks. While we were protecting our families, you were busy blocking us on Twitter, complaining about the tone of the peasants, and wondering why you're getting so much email. While we were protecting our families, you quietly raised taxes on every homeowner in Pinellas County. You chose to raise taxes in the midst of the worst financial catastrophe that some of us will ever experience. Yet you continued to pay yourselves. While we were protecting our families, you allocated over $200 million in CARES funds to special projects, including a $13 million slush fund that Barry Burton single-handedly was able to award to whatever mayors he wanted, without specific criteria other than his autonomous decision. While we were protecting our families, you voted to limit public participation in your meetings, reducing our time to communicate with you by 50% permanently. While we were protecting our families, you voted to abdicate your responsibilities and put a $200 million checkbook into the hands of an unelected county administrator, relinquishing your financial oversight to an unaccountable bureaucrat. You must have thought this gave you plausible deniability, but we did not forget. We're stuck with you for the short term, but on behalf of Pinellas Watch and many other very involved and active Pinellas County groups that have sprung up in this past year while we were protecting our families, and while you were operating in the swamp like business as usual, just know that we're here to stay. We have not forgotten what you've done, and we will continue to expose you for who you really are, and we most ultimately look forward to recapturing these seats with representatives that truly represent the people. Thank you.
Good morning. My name is Christina Ornelas. I live at 13550 Oval Drive South, just right down the street. Thank you for allowing me to come here today, and thank you for allowing me to come here without a mask. Today, I just want to share with you my personal experience over the past year. On April 3rd, 2020, I had my third baby, and it was a very stressful experience. This was the thick of the pandemic. This was when everything was completely shut down. And my sister was supposed to fly from San Diego, California to help watch my two other children while I had a planned 4-day C-section at Morton Plant. She wanted me to ask my doctor if my doctor felt it was safe for her to fly. I asked my doctor, and my doctor said it would be more harmful if she did not come. Even though I communicated what that meant to my sister, the second she was supposed to get on the plane, she did not. All of the shutdowns and the mask mandates and everything was just caused so much fear in her and so much anxiety, she didn't come. The day that I did go to deliver my son was the first time I really wore a mask, and I remember putting the mask on, being wheeled in with the wheelchair, and being handed a form. I couldn't believe the effect immediately that wearing a mask had on me. For whatever reason, I felt like I couldn't hear what the lady was saying to me. I felt like the words that I was saying were not being communicated to her. I was trying to write down my form, and even something as simple as writing my name became very confusing. My senses were immediately dulled. I struggled to remember my birth date, and I couldn't believe how much just covering my face had an effect psychologically, emotionally on me. It's been a very hard year. My husband is an ICU COVID nurse at Morton Plant. Every day, with 3 children and a newborn, we have to make the decision, are we gonna hug daddy when he comes through that door? The answer is yes, we absolutely are, because it is more harmful to not hug him. It is more harmful that he not be a part of our family. It is more harmful that we not embrace our friends, our family members. I know that all of you probably have friends and family members who have had COVID or some awful experience like mine, but every day my husband is in the trenches working in the ICU COVID unit, not only at Morton Plant, he actually has even traveled to California, Riverside, California, where it's been super busy and they've had the most cases. And even then, my husband is texting me today to tell you all that he does not support a mask mandate. Not only is it ineffective, it's foolish, it does not stop the virus, and I think that there are more social, psychological, mental, emotional harms that having a mask mandate is causing that should be risked. Thank you so much for hearing me today.
Thanks, Christina.
Hi again, I'm Jill. I live on Alameda Avenue in Clearwater. I should start by noting that I have never before been involved in anything even remotely political. Until last month, I didn't even know that speaking before the county commissioners was a thing. My family has always maintained to try to live a quiet and peaceable life. Politics and government have never interfered with that. But in 2020, our local governing body took it upon themselves to try to mandate our health. I'll admit that in the beginning days of COVID, we really didn't know what this virus was capable of. I didn't mind the push for social distancing and limiting numbers of people inside of a building. And then a bit later, however, you guys mandated that we all wear masks in order to go into a store or a building. As I mentioned last month, I'm unable to wear a mask, and the hostile community this is breeding in our county is so very unfortunate. While I do wish that this was able to be a conversation between us, instead of just me speaking to you, I do just want to share a few of my concerns. If our county's health is truly at the heart of your mandate, I'm concerned that many of you are misinformed. We now have a year of research and endless data to prove that unmasked communities do not have any more cases or death than masked communities. In fact, many unmasked communities are posting much lower numbers. Also, if our county's health is truly at the heart of this mandate, why are you not insisting that every household is taking their daily protocol of vitamin D? Irrefutable evidence from over a year of research is showing that without question, sufficient vitamin D levels are key in the recovery from COVID. A couple of you remarked in the last meeting that you feel safer because of the masks, and thus we should keep mandating that we all wear them. With all due respect, I do ask, does that go both ways? If I feel safer by maintaining a healthy lifestyle of exercise and implementing my daily vitamins and vitamin D, will you mandate that as well? It's been a year since we've watched Fauci say that, quote, we should not be wearing masks in the middle of a pandemic, end quote. It's been 8 months since the CDC that masks can't protect us from smoke particles, which are at least 4 times larger than a respiratory virus particle. My concern is that the voice of the people and the integrity of the science is being lost. We're making the effort to come and to share our hearts and to let our voices be heard, but week after week, we're being disregarded. It's disheartening to have such a huge disconnect when these decisions are being made on behalf of my family's health. I'm simply asking this: let those who feel safer with a mask on continue to wear their mask. Let us who can't either wear one or feel it's not healthy choose not to. Let's set the example to the people of Pinellas County that each person can be trusted to make the right decision for themselves. Thank you.
Hi, my name is Yvette Gaw. I'm the president of Well Life Health, and we facilitate testing throughout the country, genetic testing. So I'm very familiar with working with labs because we work with several. So I know this might be a little difficult for you guys, but we did not vote you in. We did not vote you in to manage our health or dictate what we do with our bodies and what we put on our bodies or what we put in our bodies. So what I'd like to encourage you to do is take off your blue hat, take off your red hat, and put on your critical thinking hat. And that goes for Dr. Cho, because I am appalled as someone who works in the health field and has worked out my entire life that you're telling me to put a face covering over my face to protect my health. That is such a misguidance. Okay, so there's so many places I could go with this. The problems with PCR testing. So why public officials like you guys should not base your restrictions on PCR tests. So Dr. Cho, I really want you to go back to that table and check this out. There's a massive worldwide COVID testing campaign underway, costing countries billions of dollars. But more and more experts are coming forward finally, claiming that the misuse of the PCR testing, the most common test for COVID, is resulting in a vast number of false positives. False positives, just for some of you guys who don't know. So what we're doing is we're spinning the DNA, right? We're spinning it really, really fast, and we're coming up with all these false positives. So by the time that you get to 33 cycles, 80% of them are false positives. With a CT above 35, the chance of receiving a false positive result is 97% higher. Testing is designed to substantiate clinical observation per the WHO. A PCR test is a diagnostic aid that must be looked at in conjunction with multiple other factors. We are testing healthy people. It makes no sense. Yet this appears to be the first time in history that a pandemic is being measured and managed through testing alone to justify the administration of a test. So if you truly care about tracking, tracing, and accuracy of results, then you should care about this information. So the WHO came out on the 20th. So here's the other thing that we need to know. So Dr. Cho, did you know that in 2019 and 2020, there were no more deaths in 2020 than in 2019? Did you know that we had 100,000 suicides? 100% increase. Did you know that we had a 30% increase in drug overdoses? Who are you guys kidding? So we have 3 lanes of doctors, and Dr. Cho, you're in the left lane. The middle lane, so the left lane are those doctors who are scared to speak out because they could lose their job. The middle lane are those doctors that aren't speaking out, they know the truth, and then you've got those on the right who are putting their families at risk, they're putting their medical license on the line. So this is who we're dealing with, and that's why when Governor DeSantis' roundtable got taken off, those were the doctors that were running in the right lane. So please, Dr. Cho, move to the right lane.
Hello, I'm Heidi Hilliard-Natoli, Pinellas County resident and member of Pinellas Watch. I'm here today to speak against the mask mandate. I am medically exempt, but I didn't know that in the beginning. As far as I'm aware, educating the public and businesses on the medical exemption has not been done. There are some businesses that are even no longer honoring medical exemptions. Last year, my brother got married. I was forced to wear a mask. My hands and feet were sweating, and I had sweat pouring down my back. I couldn't wait for the ceremony to be over. When we got outside, my mom removed her mask and said she felt dizzy and said there was something wrong with her vision. She said it was as if she was looking through a tunnel. Her vision finally returned to normal 1.5 hours later. Sometime last year, I had 2 customers come at me in the produce department at Publix. One of them looked at her friend and told her to stay away from me. Then the other one said, "Why aren't you wearing a mask?" I turned and walked away. At Aldi, I had the employee at the door following me around the store, even though I told her I was medically exempt. She kept her distance, but kept following me around, looking down the aisles at me. A couple weeks ago, the deli guy at Publix told me, "You know you have to wear a mask." I told him that I am medically exempt, and I am so tired of saying that. And that is where I'm at. I'm so tired of being harassed and scared about a possible confrontation with somebody because I'm not wearing a mask. Another thing I'm tired of is seeing pictures of politicians out without a mask. I don't understand how a politician could be in favor of the mask mandate but then not follow it themselves. Back in June, I'm sure you thought you were making the best decision for people when you mandated masks, but now we know more than we did in the beginning. Many areas of our country no longer have mask mandates, and research has shown that there's no statistically significant benefit to wearing a mask to protect you from a virus. I'm also not sure why we followed what China was doing. China knows nothing about human rights. The Chinese government is putting their citizens in concentration camps and committing unspeakable crimes to them solely based on their religion. The mask debate has divided so many families and friends. Even the medical professionals can't all agree on the mask mandate. The one-size-fits-all approach is not working. All people should be able to decide for themselves if they want to wear a mask or not. After all, this is what makes us human, free will. We are not lab rats. Thank you.
Tom Rask, Unincorporated Pinellas County. The agenda item is continuation of the state of local emergency. Attached to the agenda item was an item number 2 called Mask Report. And I want to come at this from the point of view, what's the quality of the decision-making here, what's the quality of material? And if you look at that mask report, it says COVID-19, a review of mask singular. I don't even know what that means. I think they meant a review of masks. Throughout the COVID-19 crisis, mask guidance is varied by state, county, expert, blah, blah, blah. Mask guidance. Is it guidance or is it mandate? And I hear everyone here refer to it as a mask mandate. It's not a mask mandate. Look at your ordinance, Pinellas County Ordinance 20-14. You mandate face coverings. Then you can look at how you define face coverings, and it could be pretty much anything. It could be mesh. So I don't think the quality of the thinking is very good here by staff. They had a free-for-all, a badly run lottery involving the vaccine before they went to an invite system. And before I forget, I want to mention that you seem to think that about 25% of seniors don't want a vaccine. That's not true. There's somebody who's 83 who is not invited to get a vaccine. You all know her. If one of staff want to contact me, I don't want to mention her name here. I got her an appointment. But there are people falling between the cracks. who are not getting invited to appointments. You acknowledged yourselves last time that the mask mandate, as you call it, is irrelevant because it's being ignored. Yes, it is. The criteria for ending this mask mandate, one of them was mentioned here by Commissioner Flower. She talked about she wanted, quote, comorbidity rates, end quote, to come down. I'd like to make a public records request for what documents, what records she has. What are her criteria? I expect there will be no records responsive to my request. It's just make it up as you go along. When the rates come down, what rates, which specific rates? Well, I'll decide that, and I'll make up my mind at that time. This reminds me, I actually traveled to the Eastern Bloc when it was still communist. And this is a book from 1972. It says, "Look, comrade, the people are laughing." And on the back it says, "They're laughing at us." Now, I'm sure none of you here think of yourselves as communists, but one thing you have in common here with the jokes, that's what this book was about. It was a bunch of jokes that people told behind the Iron Curtain. And it said that the communist leaders wanted to be the parents of the people. And that is true. They wanted to supplant the family. You want to be our parents? Our greatest wish is that you let us be orphans. Let us be orphans. We don't want you as our parents. Thank you.
Audra?
Hello.
Hello, Audra.
Hi, I'm here to tell you guys some really great news. In case you guys didn't know this, the citizens have decided the mandate's over. We're not participating anymore at all. It's done. Okay, so you're actually unnecessary to that. I just want to let you guys know that, okay? The second thing is, Dr. Cho, where are you? Where's Dr. Cho? Sir, the entire time you spoke, you had a tag hanging out from your pants. It was called a price tag. You've been bought, boy. You've been bought and paid for. You know, you spent a lot of time.
Ma'am, if you want to talk medical issues, I'm good. No. You made another comment about being bought.
He is bought.
Stay to the medical stuff, please, and all your opinions on that.
He was bought by medical money. That's a fact. As was the board.
Please.
You know, if you guys spent as much time following the finances of certain campaigns like Rat Gerard's husband and hers and Janet Long's, you would understand that it was bought. You should spend more time following campaign funds than you do COVID. For real, it'd be more productive. Probably a better use of your math skills. As for Janet Long and Pat Gerard, sorry, what people are calling you guys behind your backs. This is public comments, and this is about the state of emergency. Janet, right? People are calling Janet Long and Gerard, they're calling them the Pinellas hyenas. Have you guys heard that yet? The Pinellas hyenas. When you guys talk and you make comments, you actually laugh like hyenas. That's actually what people are calling you behind your backs. I just thought you should know that. This is in regard to the state of emergency. It is. It's totally in regard to the state of emergency.
Speak to the items and not personal.
Okay, so the mask mandate, you have to, well, actually, you don't have to. We repealed it. It's done. Okay? We don't need your little check box. We don't need that. We've already done it. We're just letting you know that we've done it. Okay? And also, people are saying that you get sexual pleasure from the masks and gagging people. That's another thing they're saying on the street. Where are you going? Where are you going, Janet? Are you leaving? Do you not like being talked to this way?
Hey,
Audra, you don't like that?
Audra.
No, I have 38 more seconds.
No. Audra, please.
She's old. Maybe she has to go to the bathroom.
That's enough.
I'm just saying.
Please, thank you.
Oh, you're welcome. No, I got 30 seconds.
No, I know, you're
29,
done.
28.
No, ma'am.
Shall I play them laughing at people like hyenas? I can do that. No, you don't like this?
No, I asked you to speak to the issues.
That is the issue.
No, it's not.
The issue is an overstep of boundaries, just like I'm doing right now. Do you like it? It's an overstep. That's what you guys are doing to us, a constant overstep of your boundaries. It's an old game.
Hello, everybody. I'm Seamus Ornelas. I didn't prepare anything today, so forgive my ineloquence. My wife called me last minute and said, you should come and speak. I'm an ICU nurse. I've been an ICU nurse for the last 7 years. As far as the mask mandate is concerned, it's foolishness. I've worked with COVID patients now for the last year firsthand, and a mask, as far as the masks that are required to be worn, do absolutely nothing in regards to keeping the spread of virus and bacteria down. They only keep it from going forward. It still goes out the side of the masks. So it's madness. In fact, the only thing that I can think that the masks are good for is for the pharmaceutical companies that benefit from the hysteria. The thing that I experienced basically 7 years ago when Baycare changed their policy from no mask wearing to mask wearing for those of us who would refuse the flu vaccination. The only thing that changed from the year before was that it became tied to money. Medicare, Medicaid mandated that 90% of all employees in healthcare facilities be vaccinated, otherwise they would be penalized by a 1% deduction of reimbursement. And that was the only thing that changed the year from before, where 40% of the whole of Baycare got vaccinated, to the next year when they were mandated to either wear a mask, which nobody wanted to do, so they got a vaccination instead. That was the only difference from the year before and after. And it was proclaimed that it was patient safety, but it was not patient safety. It was solely the 1%, which I understand it's a $6 billion, $6 billion plus industry a year, that 1% is a big deal in that $6 billion. So I understand it's a hard physical decision to make, but the mask does nothing. I've been with the sickest people in our circumstance and in California actually just recently, and the masks do nothing, literally nothing. So, but besides that, I guess one more thing is we're Americans. Ultimately, we should be free to decide how we conduct ourselves, and responsible, Good hygiene is important, which most of the sickest people that I do deal with don't have good hygiene and don't have good health. So those should be other things that we should address. Thank you.
Thank you, Seamus. Aiden Barnes and Jackie LaFleur. Hi.
Good morning.
Welcome.
Great. I have hard copies reproduced of what's stated here with references from the legitimate sources. Let me know when I time out how I can go about getting these documents to you.
She can give those to her, and she'll hand those out. Thank you, Jeff.
All right. The threshold metric of 3% for ending the mask mandate is unrealistic. PCR testing can yield up to 90% misleading positives because the cycle threshold scans, or CT scans, are at high amplifications of 37 to 40 cycles, which detect dead genetic fragments of a non-contagious virus, then recorded as case positives. Patients with CT scans above 33 to 34 are not contagious, and 37 to 40 CT is at over 1 trillion times the amplification necessary. Also, rapid antigen testing has been demonstrated to yield false positives that sometimes second tests are even needed. Over the 4 months of October through January, Pinellas average case positivity skyrocketed up 72%, while case hospitalization rates dropped 50% and case fatality rates dropped 32% over the same 4-month time frame prior to the vaccine rollout, prior to the vaccine. If this 4-month 72% case positive spike was of those truly infected with a contagious virus, then it's logical to conclude that there would also be dramatic spikes in hospitalizations and deaths, since there was no mass vaccination program for those 4 months. This suggests that PCR testing at CT scans above 34 or other testing methods are generating the misleading positives on a majority, as already stated. Remedies could be CT scans below 34, or stop testing people that aren't sick and require a second test from different manufacturers to confirm positives, or use case hospitalization rates as the threshold. Johns Hopkins University has demonstrated that higher population density is not linked with higher COVID numbers. Manatee lifted their mask mandate October 2020, and the 7-day case positivity over the past 7 months has averaged under 1% higher than that of Pinellas, under 1%. It has taken Masked Pinellas 7 months to finally catch down to and get to a slightly lower case hospitalization rate than no mask Manatee. This makes it evident that the Pinellas mask policy is of no effect when comparing the stats with that of Manatee. The mask mandate should therefore end because Pinellas residents' quality of life is being infringed upon with an ineffective intervention. This now proven ineffective policy causes businesses and schools to, in turn, cause impairments to students and employees' major life events and major bodily functions as outlined in the American Disabilities Act. These include eating, walking, speaking, breathing, learning, concentrating, communicating, working, and functions of the immune system, neurological, brain, and respiratory functions. Dr. Cho talked about how there was a policy associated with lower COVID numbers. What about when the COVID numbers upturn? You know, and I'm seeing there's a Carnegie Mellon database that shows mask compliance. And so there's been 90% mask compliance across the board, across the county for a while. And we see them going up. Thank you.
Thank you, Jeff.
Appreciate it.
Yeah. Steve Roberts, Arthur Mackwell, Gary LaFleur, Aiden Barnes, and Jackie LaFleur. Hello there, welcome.
Thank you. My name is Gary LaFleur. I've been a resident of Pinellas County for over 58 years, and I'm very thankful to the Commission for all the good work they've done over all those years. I'm very proud to be a resident. Thank you for receiving our perspectives today on this topic of great community importance. I will be sharing an edited version of the thoughts of a member of the Pinellas Watch leadership. I've come to realize that other than Mrs. Peters and Mr. Eggers, you have become callous regarding the impact of your arbitrary decisions. I want to thank Mrs. Peters for actually listening and caring about the concerns of her constituents. She is actually researching the numbers and facts herself. While some seem to be committed to Main Street media propaganda, ignoring the numbers and the science in your own county. You have set your standard as the goal positivity rate, which is a deeply flawed method, considering that the PCR test is now only used on symptomatic people, and even picks up dead viruses that are non-infectious. When you compare our county with other counties nationwide that are unmasked, the infection rates and hospitalization rates are not higher, including counties just as densely populated as ours. We are deeply disturbed by Janet Long's patronizing dismissal of citizens across Pinellas County, saying their emails are laughable, and then laughing. You are severely out of touch with your informed constituents, and we will not comply with your overreach. We have a network of Facebook friends and with over 80,000 local members, along with influencers, some of whom have over 1 million followers. We will continue to publicize the businesses and elected officials that do not respect the health exemption provision and the discretion of parents over their children as provided by your own ordinance. If you wait to lift this mandate, we all know that the school board will follow your lead. Dr. Cho advises both of them. Regarding school-aged children, have you considered that most parents are having to make their schooling decisions for next year right now? If you persist at kicking the can down the road, again, those parents can't make a decision to send their kids back to school knowing that their kids will be forced masked again in the fall. They will pull their kids out of school by default, and we will encourage them to do so. You will be looking at even higher unenrollment rates than current. Most parents cannot imagine their kids again being muzzled in the fall. They all know that how to homeschool now. You need to make the decision now. You can sit up the position of callous overlords. Thank you for your time. Please be authentic and transparent.
Good afternoon, Jackie LaFleur of Pinellas Watch. I just want to respond to some of the comments I heard from your April 8th meeting. Commissioner Peters, thank you so much for supporting the removal of the ordinance. The people really appreciate your support. Commissioner Justice, you seem to have reduced the issue down to 145 emails you don't like. If you were listening to the voice of the people, you would know many resent being required to wear masks, and a number of them are experiencing headaches, nosebleeds, dizziness, and oral health issues. The report you are waiting for won't address these problems. Commissioner Long, most people agree that safety studies have long established that seatbelts and DUI laws do save lives. However, there's a wide disagreement on the effect of masks on transmission of a virus. The extremely high recovery rate of this virus does not support masking healthy people, and especially not children. Please stop using the case positivity rate as a benchmark. Less mandatory testing means fewer healthy people are being tested. The positivity rate will go up. And as a side note, it's rather career limiting to announce to the public that their concerns over personal freedoms are laughable. Commissioner Girard, you believe that you are doing local restaurants a favor. I've talked to some of the restaurant managers who would like to be left alone to run their businesses without the meddling of this board. They would prefer to not have overzealous customers making complaints when they see another patron walking to a restroom without a mask, a situation they have no control over with or without an ordinance in place. What you are doing is helping to create friction and animosity between restaurant owners, their employees, and their customers. Removal of this ordinance would take away the perceived self-appointed right of some of our citizens to police an ordinance they incorrectly view as the law. Commissioner Flowers, you like facts. The overall recovery rate of the virus is over 99%, and those in the highest risk group were the first offered the vaccine. It sounds like you are willing for this ordinance to go on until everyone has been coerced into receiving the vaccine, or there are no more viruses floating around the county. I think we can protect the 1% without infringing on the rights of the 99%. Commissioner Eggers, it's time to start that pivot from mandating. There is significant science and empirical evidence against the use of masks for anything other than hospital environments. The WHO has said that masks are not required for children. They should be an option and not a mandate for healthy people. Good thoughts on educating the public on nutrition and exercise. These are the best measures for maintaining a strong defense against illness. Thank you so much.
Thank you, Jackie.
Hi, my name is Aiden Barnes. I've been a resident of Pinellas County my whole life. I was born and raised here, and the only time I was never in Pinellas County is when I was an Army wife living overseas. And it was a great experience. I lived in Germany, traveled all over Europe. But when I got home, I kissed the ground. I love this country. And we have freedoms here like we have no place on earth. And it's because of our Constitution. And Attorney General Barr said something, and it's just stuck with me. He said, the Constitution is not suspended, even in times of crisis. Now, we've had a lot of crises, I don't know how to put that plural, throughout our nation's history. Our founding fathers, when they designed the Bill of Rights, they knew there would be plagues. They knew there would be sicknesses, devastation. But nowhere in our constitutional rights does it say that they can be suspended arbitrarily. It's just not the case. And the only thing separating us from the rest of the world is our Constitution. So that's what's under fire here. And as a patriot myself, this is what got me fired up last summer. I've never been involved in local politics. I was just a normal stay-at-home mom of 4 kids, living my life. And then I hear that there's gonna be a mask mandate. And what had already happened before then was my kids had been forced to stay home from school, and the parks were shut down. And I felt terrible for these underprivileged children living in apartments. What were these kids supposed to do? There's no school. They can't get exercise. My kids were privileged enough to have a backyard. So I said, I need to start standing up for the people of this community. And then after that, our beaches were shut down. I go to Indian Rocks Beach, and they are blocked off. I mean, boards covering the boardwalks. I see residents trying to peer over at the sunset, and they can't see it, but there's tourists littering the beaches because they have enough money to stay at resorts. So you see, everything that's happened so far, it's affected the people in this county who don't have the money. The people in this county who are working hard at their jobs, like my neighbor who works in manufacturing. He's working 10-hour days for the past year with a neck gaiter on. There's men he works with that are getting him sick because they don't change them out. These are the people I'm standing up for, not for me. I have an exemption. I can go to my stores just fine. I'm standing up for my children. They go to Pinellas County schools, 3 of them. And my daughter in high school, she has to wear a mask to sing in chorus. She's wearing masks all day, 7 hours straight, no breaks. And my daughter, thank God they don't make her play soccer in a mask, but in schools across Pinellas County, that's happening too. Basketball, football, masked. What does this have to do with you? It does, because until you end the mask mandate, the schools are not going to end their mask mandate. That's the facts. I don't want to be here. I want to get back to my life. Please, end the mask mandate. Thank you.
Hi. My name is Megan Panic. I live in Clearwater, and I have for almost 20 years. I'll start by saying that COVID actually has run its course through my family, so I'm not one of the people who has not experienced this. My father had it, and my aunt has had it. They both were hospitalized. But they both wear a mask all the time. I'm from Northern California, and my father's been under very strict COVID rules in Northern California, and he still got it. The mask didn't work. He still stands by that. And I'm going to say what I'm going to say here. This all started like 390 days ago with 15 days to stop the spread. And here we are a year later, and the 15 days didn't work, and it hasn't worked in 390 days, and COVID's not going anywhere. It's going to stay here. Some people are really scared, and it's clear that you're some of them. But now the vaccine's available to every adult who wants it in Florida, and every scared person can go and do something to protect themselves. The masks are ineffective at best, and I really mean at best. I sent you all a letter this week that was obtained through a FOIA request from the CDC asking what basis and what studies they've done to show that the masks are effective and working. And their answer basically was, we don't really have any studies, but what we do have is an assumption that it kind of helps. So we're just going to say that everybody should do this. You're following science, you say, but really, you're following the science that you want to hear, and you're ignoring all the science you don't want to hear. When you look at the number of COVID cases in Texas since they removed their mask mandates, you'll see that they dropped. The masks didn't make a positive difference whatsoever. I have a graph here in large so you can see how Texas has changed since the ending of the masks. It hasn't changed. It went down, and you'll see that it actually, on Inauguration Day, it dramatically dropped because they changed the cycle count on the tests. It had nothing to do with the masks. It has everything to do with the cycle counts on the tests. When forcing an entire civilization to make a medical choice because you're in fear, you need to thoroughly consider the future consequences that you may be creating on these people. For instance, my great-grandfather died of an asthma attack. My grandfather died of emphysema. And until recently, we didn't know why our family members continued to die from lung issues. 2 years ago, my cousin was admitted to the hospital for lung issues, and she's a physically fit police officer. While in the hospital, they discovered that she has a genetic abnormality called alpha-1, which apparently runs in our family and affects the lungs. I may have it, my kids may have it, my sister may have it, my father may have it. Half of this room may have it, and none of you would even know it until it's too late. How does breathing carbon dioxide for years on end affect one's health? Do you know? No, you probably don't, because no one has ever done a study. This is unheard of. This is going to be like Splenda and e-cigs. Are we going to learn in a year that excessive masks were causing lung cancer or something and nobody knew? Are you insured to cover the health effects that you're creating on this future?
Thank you, Megan.
Thank you.
Hi, welcome.
Greetings. My name is Denise Lewis. I live in Tarpon Springs. I'm addressing you on the state of emergency in Pinellas County. It's time to rescind the order. In fact, it never should have been created in the first place. It's unnecessary, it's unlawful, it's unconscionable. I'd like to address 2 of you individually first, and then the group as a whole. Kathleen Peters, you are a breath of fresh air. I bow to you. I appreciate you. The rest of us appreciate you and your voice of reason. Dave Eggers, I met you at a Republican meeting last month, and I told you there, it's time to end this. You said that they have science, they're bringing science on both sides. There's science on both sides. That's true, there is science on both sides. And you know why? Because the scientists make it say what they want it to say, and that's perfectly, like, we saw that today with Dr. Cho. He makes it say what he wants it to say. There's plenty of science on both sides, so let's use the voice of reason. There is no emergency. There is no emergency in Pinellas County or in the state of Florida. There is no emergency. You know how I know that? Because you don't go to Disney World when there's a state of emergency, with or without a mask. You don't trust a little flimsy piece of cloth or paper to protect you from a virus that's deadly in a state of emergency. You don't go out to lunch with your friends and greet each other with the little mask on and then take it down and sit down. Oh, that Rona, she's pretty tricky, isn't she? She gets you when you're standing up, but not when you're sitting down. She gets you in the school, but not on the schoolyard. Oh, but wait, she doesn't get you in private schools, only in public schools. She gets you on the airplane if you're sitting side by side, but not if you're 6 feet apart. She's tricky that way, isn't she? There's no state of emergency if you go to Hobby Lobby for craft supplies. Some of you have your little things on. Are you scared? Then stay home. Does that make you feel safer? Then wear it. That's fine, but don't tell the rest of us what we need to do in order to stay safe. Safety, health is taking care of your body. That's what the true emergency is. There is an emergency. There is a state of crisis within our country, and it's not the COVID virus. It's our response to the COVID virus. It's the fact that depression is up, anxiety is up, suicide is up. Those are the things that are up. Our children are in crisis. They're in crisis, but not because of the virus. They're in crisis because of the state of our country and the way that we're acting. Domestic violence is up. Do you want to answer to that? You should answer to that. Domestic violence is up. Not because of the pandemic. 2 weeks to flatten the curve, there never was a curve. Thank you.
Thank you, Denise.
My name is Kathy Swigert, and I live in Pinellas. Thank you for the opportunity to speak. I have notes, but there are also some other things I want to bring up. One of the advantages of having the coronavirus affect me is I've had a chance to study. And I've done a lot of research on the vaccine. I've done research on the mask. I've done research on whatever has been going on. I even studied and looked up all the words to the Bill of Rights to understand that. One of the problems that we have is for every doctor who speaks in favor, as Dr. Cho did, there is another doctor or dozens who speak in opposition to that. There's a lot of conflict on the ideas of what they feel is proper on the masks, vaccines, everything else. I was actually surprised you brought up so much information about the vaccines because I thought the main subject was going to be the masks. We need to end the emergency order and mask mandates. Grant us our intelligence, please. Our intelligence to decide whether we should wear a mask or not wear a mask. Masking the children is harmful to them. The body exudes carbon dioxide, and that carbon dioxide is a cleansing system for the body to maintain health. 7 long-term side effects of wearing face masks: shortness of breath and lightheadedness. Activities that result in the expulsion of air, such as talking, yelling, singing, and exercising, can result in the accumulation of carbon dioxide between the face and the mask. Dr. Barsky. Headaches. Long-term wearing of masks can result in prolonged and repeated episodes of headaches. Dr. Bayakoti. Acne. Rewearing unwashed, reusable masks can create acne. Dr. Barsky. Development of chronic dermatitis. Dr. Coriolis. A weakened immune system. There are studies indicating that low oxygen levels in the tissues, called hypoxia, can suppress some aspects of the immune response, says Dr. Esteban Kosak. Scientific investigations have proven that a prolonged denial of enough oxygen in the body can cripple the ability of our immune system to tackle infections, which is even worse with older and younger people. Those are kids. I am a grandmother. I take my grandkids to the park. They run around. Almost nobody wears a mask, not the kids, not the parents. I don't get sick. That's a small park. There's another large park in Largo. Same thing. We were there 2 weekends ago. You see one family here, one family there, a couple of small kids wearing masks. Everybody else doesn't. Does that mean I'm over?
Yeah.
All right. Thank you.
Thank you, Kathy.
Good afternoon. I'm Bruce Feldman from Dunedin. I thank you for the opportunity to address the board today. I'm here to oppose the extension of the mask mandate. I would prefer a rescission immediately. This virus has never been as deadly as has been portrayed. Last year, the models, Dr. Cho mentioned today about models, but he kept stumbling and mumbling about all the reasons why models can be wrong. So the models have been false. Last year, they said 2 to 5 million people could die from this thing, and that was false. That started the fear machine. Fear blocks logic. And I don't have a spirit of fear, but a power of love and a sound mind. The PCR tests, which have been talked about today already, that have been calibrated falsely. Too high of cycles of the amplification cycles. The results, therefore, are suspect and unreliable. Even Carrie Mullis, the inventor of the PCR tests, said in multiple interviews that the PCR test was never intended to diagnose infectious disease. This also is 100% treatable, and we have known over the past year that treatments have been blocked for false reasons. So we could sit here and argue the science all day. But, in my mind, I kind of believe that the decision has already been made. And my problem is not so much with the science, even though that's a big problem. It's about my freedom and liberty. I don't want to be sick until proven healthy. So again, I am not sick until proven healthy. There's no reason for me to be able to have to be muzzled. It's my personal health sovereignty is what I'm looking to keep. Even though the mask mandate recently was moved in Pasco County, guess what? People still wear masks. We're capable, intelligent beings of making our own decisions concerning our health. I'm not anti-mask. I'm anti being forced to wear one. And I'll close out with this. Like I did last time, is the Declaration of Independence. The governments derive their just powers from the consent of the governed. And there's a very large growing contingent of the electorate here in Pinellas County who do not consent to this mask mandate. Thank you for your time.
Thank you, Bruce.
I'm asking you to please drop the mask mandate or face coverings, whatever they choose to call it. I have been following this issue since day one. I think this mandate has lasted long enough. People have lost their small businesses because of these government edicts. The governor has lifted this mandate, but the county commission has kept voting this in. This is a flu like any other flu. People die of the flu, especially the elderly. In the past, we've never seen any behavior like this for a flu. Children are being forced to wear masks in school, having to breathe in their own air all day. They can't socialize, and they are being restricted. What this is doing is psychological and criminal. People who work in stores also breathing in their own air, causing sinus infections and other lung problems. We need more faith and less fear. I could give statistics, but whose statistics? Do your own research. Thank you for letting me speak. Also, I cannot believe that this is America. I mean, never seen anything like this in my 77 years. please drop the mask mandate. And thank you for letting me speak, and thank you, Commissioner Peters. Thank you.
Thank you, Linda.
Hi, my name is Shannon Harrison from Largo. Good afternoon. Just a friendly reminder that we are now on day 393 of 15 days to slow the spread, and day 292 of Pinellas County Mask Ordinance, 73 short days until we reach the 1-year anniversary. You keep talking about the need to lower the case positivity rate before you feel comfortable with lifting the Mask Ordinance. But a positive case doesn't really say much. We know the majority of cases, not only in Pinellas, but worldwide, are mild. From the Pinellas County COVID dashboard, system capacity is key to ensuring that local hospitals are able to treat patients requiring hospitalization safely without resorting to crisis standards of care. We've not yet been in a state where the hospitals were overwhelmingly occupied with COVID patients, and we still aren't there. And if we wait 2 more weeks, we probably still won't be there. But yet we continue to wait. As of yesterday, the COVID occupied beds was 4%, or roughly 193 patients. In a population of roughly 1 million citizens, that is approximately 0.0193%, not 0.193% or 1.93% or 19.3%, but 0.0193%. While it is unfortunate that anyone is hospitalized, this is a very low number considering the number of people in this county that have had to seek hospitalization for treatment, some of which is not available in an outpatient setting. You don't seem too concerned about the larger number of our citizens, approximately 3652, or 0.3652%, not 3.652%, or 36.52% that are hospitalized for other issues. Just 0.3652% of these are hospitalized. Some of you say that you're sick of the mask and you're sick of hearing from some of your citizens, but it doesn't really appear to us that you're truly sick of this issue, or else you'd be working towards resolution to rescind this ordinance. You know that there are plenty of people that are still fearful of this virus based on what they hear on the news, social media, etc., and they will still comply somehow thinking this mask will save their lives, when you know full well that the majority of those wearing masks are not wearing them correctly, but they are doing so out of fear of the virus or fear of being harassed by fellow citizens or business owners. You mentioned that the ordinance is not being enforced and some of us are non-compliant. If that's the case, then why do you continue dragging your heels and deeper to continue this nonsense? We're sick of hearing, let's wait and see what might happen. We've been doing that for the past year with all the fear mongering, and yet the real world results never match the models and predictions. I truly believe you don't want to see an end to this. According to the county website, Pinellas County commissioners value volunteers who take their time to participate in their government. Based on the video from last week's work session, it seems that maybe you should revise the above statement to better state how many of you truly feel about the citizens of this county speaking up and expressing concern with how you're handling some of your responsibilities. It is very apparent that you are annoyed, and some of you even angered, that we are taking time out of our busy lives to pay attention and speak up when we feel there is an issue, especially if we have a differing opinion than the narrative.
Hey, Shannon.
We hear about.
Shannon,
Yes?
Shannon, try to wrap it up. You're about 20 seconds over.
Okay. If you haven't already, I implore every citizen to watch the last week's meeting to see for yourself. And if you agree with the commissioners on this topic, wait until you don't agree with them and see what happens. I do want to commend Commissioner Peters for standing up for us and continuing to speak with a common sense perspective and doing your research. We ask that all other commissioners do their research and listen to other perspectives other than their own.
Thank you, Shannon.
Thank you.
Thank you. Go ahead.
Mr. Chair, our next speaker is Mr. Chris Steiner. Mr. Steiner, it looks like you have already raised your hand in the Zoom application. Once you're unmuted, if you could state and spell your name for the record, state your address, you will have 3 minutes, sir.
Hi, can you hear me okay?
Yes, thank you.
All right. Well, Miranda versus Arizona, 1966, quote, where rights are secured by the Constitution are involved, there can be no rulemaking or legislation which would abrogate them, end quote. That's the U.S. Supreme Court precedent. The Constitution has no escape clause. There are 11 other precedents that reinforce this. You can do a web search of the claim and exercise of a constitutional right cannot be thus converted into a crime. That's a quote from Miller v. U.S., federal case 1956, the second district. Commissioners, in crushing local businesses, do not betray your constituents to the one world order of near uniformity of agendas. Run by multinational corporations is this new world order with no allegiance to any country. Stop us from depending on the likes of Amazon, from whom we are economically compelled to buy and be employed, and the big box stores, of course. I recommend two great sources with monumental myths and neglected news continually reporting, found over the years to be very credible. The Robert Scott Bell Show at robertscottbell.com and The High Wire with Del Bigtree at thehighwire.com. On the Pinellas County government Facebook page, under the latest vaccine post of 3 or 4 hours ago, I commented with a long list of organizations worldwide who have as members thousands of credentialed, degreed, and accomplished scientists, doctors, nurses, and other healthcare practitioners questioning the various government's responses to COVID-19, including mask mandates, or as Tom Rass explains, cloth mandates. Thank you, nanny government. So that long list, again, is on the Pinellas County government Facebook page. Under the latest vaccine post is that comment with a long list. Mandating one to wear a piece of cloth, just a personal petri dish diaper promoting pucker putrefaction, it's all risk and no benefit. No thanks. Those with a permanent lung damage, as we covered earlier, they shouldn't obstruct their breathing. It's well known. And of course, can cause further organ and lung damage and damage to other organs. Today, while we're in wholesome celebration of our environment, our beautiful purity of our air and water, in recognition of champions of air quality and water quality, in 2012, Charlie Justice and Janet Long were campaigning for this office. Their mutual main plank being to bring water fluoridation to a vote and restart it. Janet Long, April 18th, 2017, on WMNF's Midpoint Show, wrongly claimed she voted with the will of the people on water fluoridation. It's a complete lie. A massive supermajority in opposition to water fluoridation appeared that day, November 27th, 2012, the day of the vote. An abundance of information was offered to be considered, yet the vote was rushed and the meeting abruptly ended, incurring quite a bit of outrage. The phosphate fertilizer industry, an environmental overview, and a great article at fluoridealert.org that outlines how this water fluoridation is really just the addition of
Chris, you have to bring it to a close.
Waste.
Hey, Chris, yeah, you're about 20 seconds over, so please bring it to a close.
All right. Considering the ongoing radiological disaster at Piney Point, do you repudiate your respective votes having funded the massively environment-destroying phosphate mining industry by buying their industrial waste, aka industrial discharge from fertilizer factories, as the county's annual consumer confidence report on water quality?
Okay, Chris, I'm going to have to
water supply.
I'm going to have to wrap it up. Sorry about that.
I got you.
Yeah.
Thank you.
Ma'am, are you still there?
Safety is your job. Using a law that actually works, a seatbelt law as an example. First, I would like to state mandate is not law, but you knew that already, even if most of the public did not. Keeping this information directly from the public means you're participating in fraud. Even if you cannot be legally charged, there is a deeper moral law.
Is that Mary, or is that?
Good. You have also
coming from her phone line.
participated in the type of fraud regarding mask wearing. There are many studies that refer to masks as not only being ineffective, but harmful to the mask wearer. Examples are, number one, Dr. Russell Baylock, MD, states, face masks pose a serious risk to the healthy. If you are not sick, you should not wear a mask. Studies are shown proving that cloth masks do not have any effect on transmission of the COVID-19 virus. Therefore, any recommendations must be based on influenza. There is no conclusive evidence of their efficacy in controlling flu virus transmission. Blood oxygen levels were measured on 43 different doctors using an oximeter. Masks were found to reduce blood oxygen levels significantly. Another term used for a drop in oxygen is called hypoxia. Hypoxia has been shown to inhibit the type of main immune cell inhibitors that keep us from being able to breathe proper air. Also, hypoxia is also directly related to causing harm and encouraging cancer cells to grow. We are asking you, okay, especially for the children, you have to stop this madness. This has now become a mental health issue. So you need to shift from the incessant mask wearing, thinking that this is going to save your life. It's a lie, and we know this. I can tell you from personal experience, I have spent 19 years at All Children's Hospital. It was only until COVID hit that people had to wear a mask. And they see chronic diseases from all around the world. So why, with a virus that has a 99% success rate and a cure, hydroxychloroquine, why are we still doing this?
Thank you, Mary.
So please.
Thank you for
Kids.
Thank you for calling in.
Just thank you, everyone, for the opportunity to speak. My name is Rosie Purd, and I live on Orangeview in Clearwater, Florida. I appreciate the stress and the pressure that is on the commissioners to make a decision in regards to the state of emergency. There's obviously a lot of viewpoints on this topic. But one area that I'd like to bring up, which most of us have been bringing up, is the Mask Ordinance. I understand that it can be rescinded whether the state of emergency is in place or not. And with that being said, and after more than a year of this ordinance being in place, I don't understand why it's still in place. Why haven't the commissioners rescinded this? Why? I'm not going to go into all the facts and statistics or the science because it's already been presented. We all know about it by now. But we should all know by now what we have to do to prevent illness from spreading. In fact, I think everyone knows about it by now. The choice as to whether we wear a mask or not and where we wear a mask should be up to each of us. We don't need an ordinance in place to force us to wear a mask. Of note is that Pasco County, as many of you know, has rescinded theirs, and the city of Sarasota, and I believe Manatee County. You've heard from tons of citizens speaking out and asking for the ordinance to be removed. You've heard the stories of the families being shamed for not wearing a mask, which I find appalling. It's dividing us, along with many other stories. And if our government is here to represent the people and to serve the people, why isn't our county government listening to us? I urge you to listen to what us citizens are saying and rescind the Mask Ordinance. We should be allowed the freedom to make our own decisions along this line. And as a final note, even with removing social measures, and even if cases go up, we have treatments. And we know that the virus isn't as scary as we originally thought. And people do survive it. I think we all know that. And of course, many can still wear a mask if they choose. And just one final note to touch on what Commissioner Peters had said earlier. Children are experiencing anxiety. People are experiencing anxiety. I've observed this with my child even, who's she doesn't have any issues, but she's had trouble sleeping at night. She's had questions. She doesn't get what's going on. She's had fears that have popped up that I've never noticed before, and it's just with her, so I couldn't imagine all the other children that are experiencing this. It's alarming, and the rules, the lack of social contact, it's just sad to bring up our children in this environment. So I urge you to rescind the Mask Ordinance, and thank you very much for listening.
Thank you, Rosie.
Okay.
Good afternoon. Thank you for hearing us. So there's no reason to be walking around
excuse me,
with
ma'am.
Oh, sorry, Susan Bucci.
Yeah, thank you.
20 years, Pinellas County. There's no reason to be walking around with a mask, remarked Fauci during an interview on March 8th, 2020. He later said he was trying to protect the frontline workers with what he believed was a lie. But if you loosely, he uttered those words. We are being manipulated, and so are you, with so many other aspects of this pandemic. How do I know this? My scientist friends have told me how they can control the outcomes of their data to deliver a favorable result to those funding their projects because they want to keep their grant money rolling in. I know this because I know people who have worked in the PR industry cleaning up the lies told by pharmaceutical companies and also how they devised campaigns that took 10 years before unveiling certain products to the public. They would visit the movie industry, TV shows, songwriters, journalists, and plant a word here and there. It becomes a sentence, then a paragraph, and then an entire article or show. The manipulation was painstakingly methodical. I am saying the virus wasn't real. I'm not saying the virus isn't real. I had it myself. It's real, but the perceptions surrounding it have been engineered. I believe you will make the right decision if you allow yourselves to explore outside-the-box thinking. There is much information contrary to what we've been led to believe through mainstream. Pharmaceutical companies spend billions in TV ads annually. What are they getting for their money? As I described earlier, they get to change our mindset. They let that sink in. They actually get to change how we think about things. In the case of COVID-19, they massively influenced all of us through fear. They led to believe that the only way we can get back to normal is by getting a vaccine. We have now learned to hyper-focus on viruses so that we will never feel safe again unless we listen to the authorities and do exactly as they tell us. Are you even asking yourself why they haven't discussed the best way to build our immune systems to fight this virus and those to come? What's in it for them? Their narrative, their science, has been changing all along depending on how we were reacting. There is so much behind the scenes we don't know. Most of my information comes from thehighwire.com. Del Bigtree, the host, is a medical investigative journalist who has produced the daytime show The Doctors. His facts have to be sound on the show, or the show wouldn't have had any credibility. Del's team brings us top scientists, immunologists, virologists, doctors, and researchers from around the globe who are unafraid to speak against mainstream. There is another side that does not include fear-mongering, and you can find it on this show that is growing in leaps and bounds. Some of these brave professionals are putting their careers on the line, and some have lost their grants by speaking out. The pharmaceutical industry is very powerful, but these people have a conscience, and I'm truly grateful to anyone appearing on the show. Thank you for listening.
Thank you, Susan.
Good afternoon, commissioners.
Welcome.
I think I'm pulling up the caboose. Is that right? And
Well,
you're all
no,
probably
we've got-
saying it's got to be time for lunch.
Yeah, just about. There's a few others, but go ahead.
Thank you very much for having me. In fact, this is quite a surreal day for me. I'd never thought that on my 63rd birthday, I'd find myself in a place I'd never been before. And yet something told me I needed to be here. I didn't prepare really anything. I'm not a statistics person. But I did need to share something. Given my age, 63, I have to tell you that I could remember vividly growing up under the JFK administration. I was so taken up with the sense of freedom and expansiveness and citizen engagement and involvement and participation. What shocks me today, which is why it feels like quite the surreal moment, I would say almost like a Twilight Zone moment, is I would have never imagined growing up before JFK was shot, or even 5 years ago or 2 years ago, that I would actually be standing here on my birthday in front of a group of Pinellas County commissioners where I live and asking why we are still engaging in not just the option to wear masks, but why we are even discussing the mandate to wear masks, and something that appears not to be static, but something that appears to be ongoing, with even the conversation now about things like vaccines. I won't make this long, and not that I can. We have 3 minutes, and you all want to eat, and I think my husband's been trying to find out what happened to his wife. But here's what I just want to say to all of you to cap all of this off. I don't know anybody in the other room, never met them. I was surprised to see them all there, but I was also very gratified. Please, all of you, can you keep in mind that you have a tremendous amount of responsibility? Your votes speak for so many lives, people whose faces you will see and those you will never see. But I want you to know this. your votes will be forever recorded. And I would encourage you, when you decide to do things for the right reasons, I'm all fine with people wearing masks, but when we get to the place that we are mandating things and people in the future will be judging us, we really need to take stock of how we will be viewed in history. And I have to tell you, not only am I sharing that with you, but I feel the same way with myself. I haven't been to a thing like this in 25 years. Something told me I need to be here on a day to speak not just for myself, but I need to speak for so many other people that don't have a voice, that go out every day and do what they're told and don't agree with it, don't feel good about it, and are also suffering underneath it. So with that said, shall I say enjoy your lunch? And also please use your best judgment, use your integrity of heart, and remember, it's your signature, it's your name, it's your vote. Thanks all. Bye-bye.
Yeah, thank you, Maura.
Thank you.
Yeah.
Hello, my name is Jessica Carroll. I live in the city of Seminole. So I had a whole thing written out, but I'm just going to kind of riff off what I had. I just want to express, and I hope everybody who showed up in person today does hear how much love I have for my fellow citizens today, because it is amazing to hear them. And I would really like to echo a lot of the things that they expressed, but continuing, we are told to trust the experts, but which experts do you trust when they don't even agree? And I would like to direct you to the roundtable that our very own governor had recently, because I watched all 2 hours of it. It was very informative. And the majority of the panel of experts that the governor sat with argue that almost every draconian measure taken during this pandemic was unnecessary and detrimental to the economy, our children, and our health. And perhaps no aspect of the COVID conversation is more fraught with confusion than the mask. And there have been so many audacious and ridiculous claims about their effectiveness, it's been almost impossible to separate fact from the fiction. But this is what happens when something as simple as a cloth mask becomes a talisman for a cause. And we've moved beyond science and into fanaticism. Real-time data has shown that masks are not an effective measure in controlling the spread of COVID. And you've heard a lot of data. I'm not going to go over it, but it's out there, and I highly recommend that everyone go and look it up for yourselves. But one thing I wanted to point out is Norway studied the effectiveness of mask mandates to slow the spread of COVID. And when it learned it would require forcibly masking 200,000 of its citizens to stop just one infection, the country determined it was pointless to ask anyone other than the symptomatic to wear them. And in Florida, it assessed how counties that didn't have mask mandates performed versus those that did. And it found that there's essentially no difference in population-adjusted cases between masked and unmasked counties. Further, of the 20 counties that implemented a mask mandate after May 1st, only 3 had a reduction in average daily cases. And also notice Super Bowl 55 was supposed to be a super spreader event, and despite all the doomsday prophecies about maskless fans flooding the streets, more than 14 days later, new cases continued a steep downward slide in Hillsborough County. And I also just wanted to point out that essentially we've come to the conclusion that this virus is going to virus, and no amount of lockdown, social distancing, and masking will stop it. We cannot destroy ourselves with the lie of perfect control, and these sorts of false choices represent childlike thinking. Adults understand that complex problems require nuanced solutions, and we can protect those that are most vulnerable and still maintain our way of life without causing a Depression-era crisis. So I'm asking today, rescind the mask mandates, rescind the distance mandates. Thank you very much.
Thank you, Jessica. Susan.
Hi, my name is Susan Tauber, Tauber. I'm in North Reddington. Good afternoon, everyone. I apologize for registering under the wrong agenda item. Thanks for letting me speak. I do want to ask for some clarification on how we're making decisions regarding this mask mandate. A while back, the commission voted to continue the mandate based on a regional approach. At last week's work session, a commissioner stated Pinellas isn't Pasco or Manatee. So are we following a regional approach or not? Only one of you consistently come prepared with statistics, or question statistics that are presented. Thank you, Mrs. Peters. Also, there seem to be quite a few pictures floating around the clouds showing elected officials barefaced, in public, while not socially distancing. One of these elected officials sits on this board, with pictures as far back as July of last year and as recently as 6 or 7 days ago. Please think long and hard about how you vote and what you say. Social media is a very powerful platform, and many of us have seen this commissioner's rules for thee, not for me behavior. The whole thing is becoming a joke. As recorded in the agenda, 22 emails recorded for the mask mandate and nearly 300 emails asking you to rescind this mandate. Isn't it time to stop wasting time on this? Think of all the time we could have been working on mental health, drug addiction, the homeless, our veterans. But enough about masks, let's talk about money. July 7th of last year, the board approved a plan to distribute the remaining $170 million in CARES Act funding. Can you tell us the total amount, including that $170 million that passed through the county commission in CARES money? The list you made available last fall does not account for every dollar allocated, itemized, and specific. At the same time, the county's public health response was to receive $55.9 million for testing, contact tracing, and the purchase of masks for healthcare providers. Has Dr. Cho provided an itemized list of how CARES monies received from Pinellas County was spent and any residual balances? How much CARES Act money does the county still have in the bank? It was left to Mr. Burton to distribute an additional $13 million to local governments. Who got how much? And how did we get an itemized list of what they spent that money on? What was the criteria used to determine who got what? How come this board isn't asking these questions after relinquishing financial oversight to the county administrator? Florida Sunshine Law would require transparency on these issues. And we really need to get complete, detailed, itemized financials for each one of these questions. And lastly, will Pinellas match the state of Florida bill moving through the legislature, HB 945, and codify language that a state of emergency in Pinellas County going forward can be for a maximum of 42 days and 7-day increments? Thank you.
Thank you, Susan.